This is It's Not In Your Head podcast with Dan and Juz. Dan is a doctor and Justine a pain coach. We've come together to find ways to manage complex chronic pain better for both patients and providers. Hey there, welcome to another episode of It's Not In Your Head. I'm your co-host, Justine Feidelson, here with Dr. Dan Bates. Hey, Dan.
Hey, Juz. How are you this morning, this afternoon,
Good.
Or whatever it is for you?
I'm good. I'm looking forward to diving into this episode today. A few episodes ago, we dove into the neuropathic pain algorithm, where we covered a lot of the more interventive, medication-related, medical system side piece of how you would treat, in that case, neuropathic pain. But a lot of that applies to, regardless of what type of pain pathology you have, things that you would have to outsource and have your doctor look at and walk you through. Today, we want to get into a lot more of the things on the conservative side, but we're going to start with just the very, very basics, in a sense, sort of the basics of the basics, and take you through some of the low-hanging fruit that applies to really everybody who has chronic pain. So as you get more complex, as you get more essentially sensitized, more of the lifestyle pieces and buckets of things become non-negotiable. Poor lifestyle factors, accentuate things even more. And that's where I develop my MARSMethod, which gives a structure and a framework to basically identify what those things are for you and progress them long term. But the things we want to pull out today are the things that Dan starts, like I said, anybody with. And no matter what, you really need to make sure are in order so that you get the most out of the medications and the other side of things from a treatment perspective that are a part of your plan. And from a psychological, mental perspective, regardless of the underlying physiological, metabolic impacts of these things, the reason it's so important is because you can't outsource your agency. There is a lot that you as a patient impact, and understanding that and feeling that is crucial for the long-term outcomes and to combat hopelessness and sort of that feeling of being reliant on others rather than being able to tap yourself in difficult times. So I can speak also for myself and for my own experience. One of the most frustrating things about dealing with chronic illness, chronic pain, is not having the capacity or the energy to do the things that you want to do. And even when I do things perfectly, I still have limitations. There's still things I can't do. When I don't do things so perfectly and I fall off, that's why we did the flare episode, it makes it almost impossible. So if you can at least maintain some of these basic things and get on top of those, it'll give you a much better chance as you go through the rest of the steps in making your pain smaller and smaller over time. Right, Dan?
Right. The other thing that happens is when you completely and utterly overload yourself and don't give yourself any breaks during the week. Hey, Juz.
What? Who are we talking about? Right. So lack of capacity with lack of fuel and underlying things that can sustain that equals flare. 100%.
And lack of a handbrake.
Lack of acceptance?
Lack of a handbrake, to pull the handbrake on and go, hey, maybe I won't do all that stuff.
Yeah. Dan and I were laughing about how I bottomed out a little bit again this week. And it's not a big crisis where you have this massive, accrual of allostatic load. There are those weeks, though, where you just don't accept as much, that you have certain limitations. You don't want to have them, especially when it's from things that are more fun and more personal life stuff and not working yourself to death. It's harder to accept that you have some of those limits, but it's not just the limits. It's what did I do less? Eat, drink, sleep was pretty good. But some of these obvious things, even I struggle with at times. So
Juz was overcooked this week, is how we would say it.
Yeah.
So that's all right.
So it happens to all of us. But if you do the best you can, it makes it easier. Yes.
Okay, so as we discussed, this is partly going to focus really on the basics of the basics, but to give a bit more of a broad overview, take us through your MARS method and, what does MARS stand for, and take us through MAR and S.
Yes. So this acronym, you could say, what does MARS really mean? It just sticks and it works well. And I've had it since the beginning. So that's what I'm going with. But the M stands with movement. The A stands for awareness. The R is recovery. And the S is stress. And these are essentially the four buckets that, as we talked through in earlier episodes, really either are responsible for or can help address the contributors to pain, sensitizers / amplifiers to your pain. So these are essentially the patient aspects of pain management, right? So this is how you can look at what are the four buckets of things that I impact and improving those over time. So under the movement bucket, just to give you kind of a general lay of the land, that will cover things like mobility, reflexive stability, right? Sort of the PT bucket of things where you're dealing with underlying compensation patterns, ideally, improving your movement patterns over time, aerobic and strength, properly progressed sort of with your nervous system and desensitization at the center of how you're doing that, having different ways to downregulate and work through pain or areas of stiffness and discomfort that, again, you're able to do as a patient with things like release techniques rather than having to outsource every time you're in pain or every time, why is this happening? I got to go see my PT. Not ideal because yes, though sometimes we need that, you want to have some of those tools at your disposal and so that you can go to them in different situations, in different settings. During flares, there's different ways that you'd want to do movement versus not. And so having different techniques and strategies to go to, depending on where you're at, from barely moving to being relatively active is really important. And then the A, from an awareness perspective, that's things like mindfulness, right? Noticing your own pain patterns, the way your body responds to people, places, and things. Different things around pacing, I would even put under here around like, what did I do this week? Full schedule, did not want to have pressure release valves, did not succeed at taking windows off that I normally do. That's a pacing issue, right? It's just daytime energy management.
Hot was it?
Yeah, it was 87 degrees Sunday night at midnight still in my condo.
For everybody who doesn't even, for everybody in Australia, how hot?
Yeah, I wasn't just nuts.
That's
it was
like, what's that? That's 30 something.
At night.
Yeah, that's toasty.
Yeah, very, very hot.
That makes everybody crazy eventually.
It did make me crazy. I had a period of temporary insanity, and I blame it on the heat stroke.
The piece of the awareness bit is that, next time we know it's going to be hot, and you manage.
Dan's like, next time, could you check the weather in advance? I was like, that's a really good idea, Dan.
No, but it's sort of like it just falls into the things bucket, like the people, places, and things, and the thing that when it gets really hot, we we'll struggle. That you need more fluids, you need more X, you need that.
Add electrolytes. Yeah, the regular is not enough.
And I think that if there's one good thing about the weather is that there's a forecast. And so if you can see that, you can plan for it. But everybody can do the same.
Yeah. So how you organize yourself during the day matters. Being able to plan ahead and adjusting, yes, for these types of circumstances. And if you're someone who's a POTSI, right, you have dysautonomia, you have some of these things with hypermobility too, where it always kicks up when the temperature gets higher. To Dan's point, plan. Don't be like me. In the recovery, R bucket, that one's pretty self-explanatory. Sleep, right? That's things like circadian rhythm, your sleep-wake cycle. We'll talk about the importance of going to sleep at the same time, morning and evening. And your wind down routine in particular is a good one to kind of pull out of there and practice if you can. And the other side of this is nutrition, fueling. People forget what a big component food is for energy, but it is a big deal. And your daytime habits will affect how you can recover at night, sometimes eating too late, cortisol, things around that. So nutrition is the daytime piece of energy management, aside from pacing, and sleep is the nighttime piece of things. And then the S bucket, as far as stress, this one has a bit of a disproportionate impact when it comes to pathologies like complex regional pain syndrome, or yes, the more complex people get in other ways. Stress is universal. Allostatic load accruing is universal. The struggle that I had this last week is pretty universal. So is mood stuff, anxiety, depression, right? Being able to downregulate. We touched on that a little bit before, but with breathing techniques, things like that. Trauma goes under here. Some of that you need to outsource in parallel to working through it yourself. Boundaries, communication, like family system stuff is a big one that people oversee sometimes under this bucket. And just your overall perspective and mindset, like we've talked about in various ways with how do you approach pain and how do you work through it. So these are the general MARS buckets, which is a lot. Like it's simple, it's everyday stuff, right? But it's a lot. And so we're not going to get into the behavior change or the progressions of all that today. I just wanted to give you a good lay of the land, and then we'll pick out the ones that everybody can get started on under pretty much each of those. That'll be a good starting point.
Yeah. And so I think the reason why we really wanted to sort of go through that whole approach that Juz takes is that it's really broad. And so I send Justine quite a number of patients, and particularly patients that are ready to start and ready to sort of start going in this direction. And also complex patients that have just got lots of stuff going on that need a structure. And, the Mars structure gives you a way to sort of work through stuff. I can give people a structure to work through. How do we diagnose? How do we then, start treating? But I don't have literally the time to be able to go through all the stuff that Justine does. And
you barely have the time to go through yours.
Yeah. And the other thing I don't have is I don't have the skill base. And so this is a completely separate skill base to what mine is, and where I realize what it is and I understand what it is, I don't have the skills in implementing it, and Justine does. And I think that so for those patients that, want to reach out to Justine and maybe talk to her about doing some stuff with her, this is the thing that she goes through. And for others, she does a base camp that is a 10-week program.
8 weeks? 8
weeks.
Pretty long.
8-week program that takes people through all these things in a structured fashion, rather than it be. And so it's not as individualized, but it gives you, guidance on how to work through all this stuff, which is what Juz does, which is different to what I do, certainly.
Complementary. That's what's great about it, though. Yeah. And it gets the most out of what you do, Dan, too, as far as helping what you do be most effective.
Yeah. Like I can diagnose, block and burn and, do X, Y, and Z. But realistically, we need to be able to cover off on how we're thinking about stuff, how you're sleeping, how you're, eating, drinking, to be able to sort of fix the basics of it. So, which is kind of
I was going to say, that's why we're doing today's episode too.
Where we want to lead in. Because what I've been finding is that there are some set basics that for me, I just would like patients to be able to go, okay, where the hell do I start? Okay, let's start at these 5 things. And, to tick them off, those 5 things are going to be protein intake, hydration, fiber intake, sleep, and then how do you get doing a little bit of exercise? And we'll just work through each one of those in a simple structure so that you have a way to tick those buckets for yourself. And it also is something that you can do by yourself at home.
Yes. And you don't need my guidance for the stuff we're talking about today. That's what's great about it, is anybody can do it, and it does move the needle. Yeah. And we were talking before, Dan, that the reason too behind the importance of this is before you would go down the track of testing somebody for a bunch of different metabolic stuff or even some coexisting things, you would want them to cross these things being addressed off first, right?
Yeah. So look, it's increasingly obvious for for a number of the patients I'm seeing that there's an enormous amount of metabolic dysfunction that's taking place, and so that is driving patients' pain. So the thing that's interesting about this is, where I've thought this for quite some time now, and I've been able, you can do some blood tests and find stuff. I've never really been able to prove it. However, I'm about to talk about a patient that I have that has a neuromodulator in. It's the company is Saluda. Now, just for disclosure points, I'm not a consultant for Saluda, but I do use their stuff, and I use it because I like it. So this patient's had neuropathic pain for a very long time. They have a neuromodulator in place. And what this neuromodulator does is allow us to test the sensitivity of the spinal cord. And it allows us to then change the dose of the stimulation to get it within a therapeutic window. And so their magic therapeutic window is 1.4 times what they refer to as the sensory threshold. So that's technical jargon, but basically what it means is there's a little set of electrodes that sits at the back of somebody's spine. What takes place is that you can make it buzz, and the point in time at which you can feel it buzzing is called the sensory threshold, and the level at which is 1.4 times that sensory threshold is their magic number that allows them to get best pain relief. So, which is amazing that we can now dose people.
And that's different than the system where it's adjusting the dose of the stimulation based upon spinal position now, right? And that's not looking at the sensitivity of the spinal cord. It's just the position.
That's changing. Yeah. So Medtronic has got a device that does that. So
mine does not do that. Yeah.
Yeah, and Saluda does do that because what it's measuring is changes in the spinal cord. So it's doing that, but it's not doing that in the same way that the Medtronic devices do it.
Got it. Okay.
So this patient, they get intermittent flares of pain, and they recently had another flare of pain. And for the first time, I was able to say, okay, let's get the programmers in. Let's see if the sensitivity of his spinal cord has changed.
Yeah.
And it had.
Lo and behold.
Yeah. They had a change in the sensitivity of their spinal cord, and we were able to then readjust the dose, and we'll see how long it takes to get better, which I expect will be Monday. But the thing that is fascinating about that is that, at the same time, their anxiety had gone off. And I was just thinking through, previously we thought, the pain gets worse, you worsen somebody's anxiety, or somebody ticks off somebody's anxiety
gets worse,
and then the pain gets worse. So it's like this bi-directional relationship. What about if it's not? What about if it's a metabolic change that takes place and that then changes the sensitivity of the nervous system, and surprise, surprise, your pain gets worse and your anxiety gets worse, but they're not directly related, which, they are directly related because we do know they have a bidirectional relationship, but maybe that's not the trigger.
So we're not the sole reason for the amplification of the anxiety, where yes, higher pain makes you more anxious and more anxiety increases pain, but not without anything else also.
Yeah, so what triggered it off? Why have they been able to previously walk up and down stairs without any problems, and then all of a sudden they can't? Like, why did that take place? And I think that that's a metabolic change. So the key is then finding what is the metabolic change that's occurred to be able to, identify that. And
we'll do a whole future episode where we dive more into like metabolic reasons and drivers for pain, because that's where we talk about you have to find what's driving it, because you can't mindset yourself out of a metabolic reason for your heightened pain. It's not a mood issue. It's an input that's unaddressed or unknown. You could argue.
And so we're just effectively working off that idea that, yes, anecdotally we can see changes in, well, at least one patient's spinal cord sensitivity or nervous system sensitivity, and see alterations in their pain. And I'm presuming that's a metabolic issue. But you see a bunch of other patients come in and they'll have diabetes, they have hyperthyroidism, they've got things like celiac disease, they've got multiple inflammatory disorders, just one inflammatory disorders. All these things affect your nervous system. And there are some basics in the background that we can work on, particularly. And the other logical things are people that don't sleep. So the lack of sleep that puts your circadian rhythm out, like that will drive pain, and essentially a sedentary lifestyle. So being sedentary. And, I got to get better at doing this, but I miss how little a number of my patients do. I had a patient in recently who had essentially muscle soreness after getting their steps up to 2,500. And I'm like,
I remember this.
Okay, great. 2,500.
Yeah.
That's really good. And she then pointed out
calves are killing me.
that she started at, or that they started 200? At 120. 120.
Yes. Yeah.
And I was like,
so you've
done. I missed that one in the
I feel like a jerk.
in the initial history taking. Oops.
Well.
And I think it's one of those things I need to get better at trying to identify, because I think these are some of the basics we may be able to tweak at the start that give you some ways to, change things without spending money on me.
You don't need a trainer yet. You're not at a point where my expertise would even be relevant or come into play. You literally just need to, from a pacing perspective, progress a type of cyclical aerobic movement, walking, basically. And if you look at pain as an alarm system sort of too vaguely, that's where I think if you can avoid deconditioning and more parts of your body kind of being like simplistic explanation, right? But like, help, I'm atrophying. It's not helpful when you start to have more of those things adding up to, wow, it's a bigger and bigger barrier to entry to even get going. And so if you can start it earlier, it makes it less daunting down the line, because it's tough.
All right, so let's move on and start talking about we'll go with protein first. So just go through for us, why is having a reasonable amount of protein in your diet important?
The two basic main ones I would say are from a body composition perspective. When you're not moving and you're pretty sedentary, you're already struggling with wasting. So in order to maintain muscle mass, it's really, really important to at least have enough protein to have the building blocks to maintain them as well as possible. The other side of things that I see affect people pretty significantly is from a satiety perspective. People that lack protein, their hunger signaling is way more off kilter as far as you're really, really hungry. Sometimes you lack appetite and the desire for carbs. And some of the more unhealthy things tends to increase when people severely lack protein. Whereas if you hit your protein target from a grams perspective, like Dan will get into, you're way less likely to overeat in carbs, sugars, some of the other things that come along when you suddenly are like, wow, I'm ravenous. And then you're making not as great choices. So those are the two most obvious ways that protein is really important. And aside from the importance, what I notice a lot is just how many people don't realize how little they're actually getting, or you think you're getting a lot more than you actually are. And 60 grams a day is probably like average. And people come to me often less than that even and think they're getting adequate amounts. And it can be a little shocking when then they hear what they should actually be shooting for. And it's a lot more. And then in the HEDS context, we'll talk about that so much, but it's particularly important because it's the driver or one of the drivers of why you're having such an output of symptoms, right, Dan?
Yeah. And I think that I'd probably add to that. So we would talk about the hypermobile EDS patient and that, it appears based on some of the literature that it's a protein metabolism disorder with poor collagen synthesis and increased collagen breakdown. And so the way, we've been managing that has been with increasing patients' intake of protein to sort of try and balance that out. But we'll talk about that in another episode in detail. I think there's two other really important components to protein intake, both of them really being out of the sarcopenia literature. So sarcopenia is the muscle loss that you get over time as you age. And so there's been some good data that shows that, yes, you can, if you're older and you go to the gym, you will put on muscle mass and you will get stronger. That's just pretty, use it and it gets bigger. But the interesting thing is that it works better, much, much better if you increase your protein intake. And you might find that you don't get the strength and muscle mass gains without the protein. If you don't eat the protein, you can go to the gym, you don't get bigger.
This is why I am always on my dad's ass. He's 70. He's so much better now. I train him. I give him his workouts and he's in the gym twice a week doing his full body resistance now for like a couple of years, but he struggles to eat enough and get enough protein because he doesn't pay attention to hunger signals, gets distracted. And that's exactly the piece where I'm like, make your work pay off as much as possible, The
other thing that's really important is with sarcopenia, the gradual loss of muscle over time. If you look at the data is you lose 1.5 to 3% of strength or muscle mass per year. So if you're at the top end of that, 10 years is 30%. And
that's why I'm
that's a lot of muscle mass. Now, interestingly, some of the more recent data shows that it's not a gradual loss. What actually happens is you'll get injured, have an operation, get sick,
it's the period,
and you lose 10%. So like over 10 years, yes, you might lose 30%, but it's 10, 10, and 10, and we average it out across the year. And because you're using population data in this setting, we're seeing an average of 1.5 to 3%. But if you looked at individuals, it's 10, 10, 10 across that. Yeah. So that becomes, so what's really important there is that when you are unwell or you do have a period of time when you're unwell, maintaining your protein intake so you minimize your muscle loss becomes really important.
It gives you more of a buffer. You have a little bit more room for error than when you fall off the wagon physically, which is inevitable and will happen at times, although you want to avoid it as much as possible. Yeah.
So, all right. So the question then is dosing. So what's the dose of protein you need each day? And so the recommended daily intake is 0.8 grams per kilogram per day. And I would argue that that is just to maintain survival.
It's bare minimum, basically.
Yeah. So the data around what do people who are medically unwell need? And so if you look at that, and let's be honest, if you're listening to this podcast,
That's
and it's
you.
not for somebody else, you tick the medically unwell
Yeah.
box. And so that's 1.2 to 1.5 grams per kilogram per day. When we are trying to get people to put on muscle mass within, particularly like if I'm ever working with elite athletes, we'll be targeting 1.6 to
Higher.
2 grams per kilogram per day.
And that's
And
more
that's
performance.
basically where it sits. Now, my ideal goal for patients is that they're targeting that 1.6 to 2 grams per kilogram per day. Why is that? And that's because, number one, we know that that level of protein intake is safe. We also know, and even though, an athlete is trying to go at their 100%, which is higher than, well, my or Jazz's
Right.
100%, you're still going at your 100%. And
Yeah.
so supplying enough protein to be able to drive your, muscle synthesis at a point that is 100% for you, I think
Yes.
is worthwhile. The thing you need to be cautious of with protein intake is if you have got kidney problems. So there are some circumstances within people who have a degree of kidney failure that you have to wind back your protein intake. But that, speak to a GP or speak to your kidney physician about what your dosage should be like. I'll bet you that you're probably nowhere near it at any rate. So
Highly unlikely to be an issue, but yeah.
So there's your dose, 1.2 to 2 grams per kilogram per day. Now, if you try and eat that in steak or chicken, that is tons of calories. All right. So you can't actually do it. You can't do that you can't do it in.
Or the amount you'd have to eat would be
it's enormous.
uncomfortable. It's not that calorie wise, it might not be.
So Maddie
crazy,
is my 14-year-old, and
the middle child.
The middle child. They send me these Insta reels of this guy that's always like, I get to hit my protein intake.
Like with my father.
And he'll sit there and cook up 20 eggs or like a kilogram of steak and then eat his way through it. And it's not possible for normal human beings to do it.
Yeah, let alone when you're nauseous, lack of appetite. There's all these barriers to food aversion. So that's where you got to work around.
All right, so Jazz has got a bunch of things I've stolen. So Jazz, tell us about upgrading. And how do you do it?
Dan only takes the stuff he can implement. But the concept of upgrades is simple, and please steal that if you find it useful. But basically, it's just like it sounds. Look at what you're already eating, so you don't have to add new, different shit to your routine. First, upgrade what you're already doing. So if you always buy, like one gal in my group course comes to mind, she gets Mission tortillas all the time. Well, they have a whole wheat version that's like 11 grams of protein instead of 3 or 2. Is that a huge amount? Not alone individually, but if you're eating that like every day or multiple times a week, just that one change can be like 100 grams more in a week or something like that, for example. So look at things like that you can improve the quality and the amount of protein in. Outside of individual items, you can look at how, like, is your own breakfast or a meal constructed? Do you usually have it without protein? Cool. Add some string cheese, add a little Greek yogurt. It's just an opportunity to add protein to a meal you're already having that didn't have it before. You can also look at snacks as an opportunity. A lot of people think snacks are like bad, negative, or they're inadvertently eating not great choices for snacks, which then make them that. But they're not bad, they're necessary, and they can be a really helpful spot to inject some protein into your diet, because if you're only eating 2 main meals, or you're not hungry in the morning for breakfast, really quickly, when you look at your food journal, there's a lack of opportunities to even get food in. After that, you can look at, you're already having chicken, or there's already some protein in a meal. Can you increase the amount of protein? Can you improve the type of protein where maybe it has more grams in the same amount if mass is hard to get in? So all of those are, in a sense, upgrades or ways that you can look to improve what you're already eating or add to what you're already eating. But the upgrade term, and the way Dan and I use it, is where it's like a specific item, and that makes it kind of a fun, like, hunt for better alternatives game. And then the easiest way is through supplements, which is one that Dan does often with patients, because it's really helpful too when, again, you don't have the behavioral changes set in yet. You don't have the ability to change or improve a bunch of things yet. What can you tolerate and what can you get in easily that doesn't take a whole bunch of extra effort and thought, but it makes a big difference? And there's nothing wrong with using supplements until you can integrate more of the sourcing, right, grocery shopping and thinking that requires systems to then have around you and decrease the barrier to entry to, because you can't be on supplements forever, but make things easier and more convenient that you can. And yes, you can be on them forever. I don't mean it that way. I mean, they shouldn't be like the only way that you get protein, forever.
Yeah. So I got 3 upgrade strategies that I use for different types of protein. So everyone's going to ask the question, what protein should I eat? The answer is, I don't care. Just get it in, because it's more about, for me, it's more about just increase your protein intake and do it in a way that you tolerate it. Because most people, it's an issue of being able to tolerate whatever protein they're putting in. Find something you like. If you don't like it, don't worry about it. Try something else. So the type probably doesn't matter. I think if you get into the literature on this, sure. Like different proteins have different effects, but
creatine, whey, you could argue.
We're not talking about making you, lift or get your muscle mass bigger than, a general gym junkie, who, by the way, will be eating 3.5 grams per kilogram per day. They won't be eating 1.6 to 2. They'd think
it's not the supplement that's actually
that would be. They'd think I was soft if I was doing that. So 3 strategies. So hydrolyzed collagen. Hydrolyzed collagen dissolves into pretty much everything. If you get flavorless stuff, it dissolves, and it actually is flavorless, which is quite interesting. So you can, if you drink tea, coffee, hot drinks, you can mix it in and it just disappears. You can't even tell. I think also because hydrolyzed collagen is just, hydrolyzed tendons, basically. Right. Basically what it does, you can mix that in with things like with stir fries and other sort of meals along those lines, that it just disappears. It
just becomes part of the sauce.
Yeah. The second thing is, adding yogurt to a meal is good. I also suggest you can add protein to the yogurt. So you can once again get flavorless whey. So
upgrade.
Flavorless whey, and you put in get a scoop, which is generally 25 grams of flavorless whey into yogurt. So what you're doing is you're putting milk back into milk. When you start mixing it first, it looks a bit gluggy, but you get there. Just keep going.
It tastes fine.
It goes back to looking like yogurt again. And if you've got some sort of flavor
curdled
in it, it doesn't even look curdled if you mix it. And if you add in if it's got a bit of flavor in it, at any rate, yes, it is actually flavorless. Although flavorless whey is not 100% flavorless, it just doesn't taste like.
I find the collagen
chocolate
to be more flavorless.
Yeah, the collagen's very flavorless. And then the last piece is that for patients that are taking in heaps of water each day, and for those who've got pots, etc., and you've got your target of 3 liters a day, mixing in some of the protein water products can be an easy way of just adding up, just upgrading the amount of water that you're taking in, chucking a scoop of protein, and then away you go. And so each one of those things is something that you can do without changing your eating strategies.
It's just like the upgrades. They are upgrades. You haven't changed anything. You haven't added, oh no, I need more meal prepping. And what I actually love about your suggestions, Dan, is that it's not like pour your 25 grams into a thing with water and now you have this big shake that you have to glug down, or do that 3 times a day. People can't do. But when you sneak it into your food like this, you don't even know that you're adding supplements, and that is fine. There's nothing less than about that type of protein compared to regular food. You're just not making it, such a challenge to get in.
Yeah. I don't think you can
you can't. And bars don't taste good. People have TMJ. It's uncomfortable to chew at times, right? And then you very quickly get bored of the flavor. You have to cycle things. And so this is a great way to make it sort of out of sight, out of mind. And then you don't even know you're dramatically increasing the numbers.
Yep. That's how I do it.
Okay.
Which I ripped off from you, by the way. So,
Well, I like these implementations, though. You get creative credit for that.
Oh, yes. It's Jazz with Dan Flair. Awesome.
Jan. What would we be if we combined our names? Does?
Does.
Jan. Together we are Jan. All right. Tell us, Dan, how do you choose, or how do you kind of select what types of proteins to go after from
how do you
narrow
choose?
down?
All right.
Yes.
All right. So there's a million, protein products on the market. One of the biggest problems with protein products is that they get contaminated with
the marketing
other stuff. And the other stuff is probably somewhere between testosterone and growth hormone. And, I imagine somewhere people are chucking in peptides and blah, 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 whatever at the moment.
Yeah. Don't need any of that.
No, you don't, because we've already got ourselves in a metabolic dilemma. So we don't want to be throwing in stuff that we don't know what's in. So the safest way to go about doing it is look for a product that has got boring packaging. Okay, yes. Because let's be honest, if on the outside of the package is some dude that is like, I've got like massive guns, there's probably something else in the protein that gives you the massive guns other than, the protein and go lift something. So look for stuff that has got a boring package. Look to see if they test it. Okay. And so the boring package and a company that says, hey, we independently test or we randomly test our batches so that we know what's in it. Perfect. The thing you just need to be aware of is that if you are an athlete and you're competitive and you may get tested, just be aware of those issues that if you might come up positive. Interestingly, though, the thing that I think one of the things that's been getting people tested positive lately is, those protein balls at the local cafe? Yeah, those protein balls have been what gets people.
Yeah. Interesting. Don't do that upgrade.
We don't have a recommendation of a company in the US, but we'll probably look out and see if we can find one. But in Australia, I recommend looking at bulknutrients.com.au. I don't have any affiliation with Bulk Nutrients. Basically, what I've found with them is that they do have boring packaging. They're well priced. They have multiple different products and they deliver quickly. So from a service perspective and product perspective, they're really good. And I think they tick the boring package box and they tick the random testing box. So I think they're a very good product. So if you're in Australia, you can have a look at those guys. There is a bunch of other companies in Australia that are high quality. It's just they're the ones that I direct people to because it's easy. One of the other things you can do is within that environment is to get started is just get a bunch of sample packs. Work out the things you like, work out the things you don't like.
Don't get a massive tub before you try it, then you don't like it and you're stuck with it.
Yeah. So get a bunch of sample packs, work your way through the whey, soy, pea, rice, future whey, protein, whatever. Get a bunch of different things, see what works for you, and chuck out the things that make you nauseous and you don't want to ever see again.
I don't like the taste of it. And one thing to probably note is if you are someone who's vegan or chooses to eat plant protein, really the only downside is that you do have to actually ingest more protein to absorb, because you don't absorb as much plant protein as you do animal protein. So if you consume 20 grams of plant protein, you're not getting the whole 20 grams the way you are with 20 grams of animal protein. And you have to ingest more to get that full amount. So it's just something to keep in mind. If you are going more for those types of sources, maybe do a mixed, or you just have to increase the amount because the bioavailability is a little bit different at the end of it.
One little other trick, because you just said the word mixed, that I use for some people is that if you find that the flavors are too strong, you can halve and halve it. So use half a flavored one and then half an unflavored one and then go with that. So it decreases how strong the flavors are at some point in time, which makes them a bit more tolerable if you are struggling tolerating them. All right. Easy thing to do within the food area is fiber.
Yes.
So why fiber? So
fiber.
All right. So there's essentially little doubt that the gut microbiome plays an exceptionally important role in our body. And there's this thing called the gut-brain axis where all little bugs in your tummy release a whole stack of different chemicals that then affect the way we feel, they affect emotion, they affect pain, they affect all number of things. And the data is pretty much indisputable now.
Yeah.
What's also in the data is that you can change these things, and there's certain little bugs that have important roles within your gastrointestinal system that will result in positive or negative outcomes. What I'm struggling with within this part of the literature at the moment is how do you change that over the long term? So
Right.
you can take probiotics, and my read on it is that yes, you can take them, it'll change your gut microbiome, but it won't do it forever. And
Right.
or you stop
It's for a
and your
period
gut
you're
you
dependent on
stop
still.
and your gut microbiome just goes back to what it was beforehand. I haven't seen anything that looks like it's super long-term viable yet.
And this is one of the challenges with the FODMAP diet approach is that, yes, it's effective and it's helpful, but it's also it's hard to adhere to and it's hard to do forever. People they do a good job of it. They do it successfully, but that's one of the challenges is even when you follow that method, there's a lot of elimination, right, restriction around it, and you're stuck doing it to maintain the results.
Yeah. The other thing that within that world as well, particularly within the world of what's happening in the literature, there's plenty of data that is showing, well, you can give somebody this bacteria and they get positive outcomes from it. But how do you then get access to that bacteria? It's a lot of time than on the market. I think there's a couple of products that have made it to market, but not tons. And they're not super easy to access. So probiotics as such doesn't really fit into the way I think about things. But the thing that you can change is fiber intake. And so
and you can do that in a way that is FODMAP friendly. Yes, then that's exactly what we'll go through. We'll give you options that are appropriate if you struggle with this type of
Fiber basically acts as what's called a prebiotic, and the bacteria in your gastrointestinal system effectively feed off it and multiply and create good bacteria, for want of a better discussion. The two things that I think you can look at, first of all, what's a dose? So the dose you can look at is 25 grams for females and 38 grams for males is a daily dose. How you work out how much you're taking at the moment is get an app like MyFitnessPal.
Track your food.
Yeah, if you're in Australia, there's a free app called Easy Diet, which has got a bunch of Australian foods in it that you can just plug in your food and you can work out how much fiber am I getting in today in at the moment. Similarly, when you're working out what you need from protein, you can plug in what you normally get out in.
Yeah.
Go, hey, I'm already getting 40 grams. I need to top up by 60 grams and then that becomes your target. So you don't, if you've got a target of 100 grams, don't add in 100 grams of sup, add in 60, which is on top of what you're normally taking in.
And when you set that up, like even though we're on fiber, from a protein perspective, I like to do like a 40-30-30 split as far as carbs, proteins, fats, if you were looking at it from a macro perspective, because then it will spit out your goals more accurately depending on that split as far as what grams are you shooting for protein, carbs, fats in that spread. Track it.
Once you've worked out what your fiber intake is off an app, then you can top up. And so once again, it's kind of the upgrading approach. Yeah. So there's a bunch of different types of fiber. You can look at soluble and insoluble fiber. I think the easiest thing to look at is something like inulin. So inulin is a standard prebiotic. Generally, you can get it at most chemists. It's not particularly expensive and it dissolves in everything. And so one of the easiest things to do with inulin is just tip it into a bag of protein and give it a good shake and then it's dissolved in. So then you're
spiking your protein with fiber.
Yeah. So you spike your protein with fiber. And so all of a sudden you've whatever you're putting in is dissolved. You can't taste it. It's really, really simple to do. The other thing you can look at doing is looking at some of the other soluble fibers as well. There's a bunch of different brands in Australia, Benefibe, Metamucil, etc. They're in So those sort of approaches, which are combinations of psyllium and other variations, are also good. They're just easy to get in. They dissolve pretty easily. There's some other products certainly in Australia, developed in Australia, which I should have looked up before I got chit-chatting.
We could probably throw some on the website too, maybe resource-wise, Dan, for folks.
Yeah. And just once again, we don't have any association with any fiber manufacturers.
Nope.
Not really.
Not affiliated with the My Macros tracking app. Yeah. That's a good one in
no.
America if you need one.
So have a look at those things. So target 25 grams for females, 38 grams for males.
And I really like addressing fiber with supplements because fiber is a tough one to increase. Like sometimes roughage, right, or vegetables it's harder than increasing protein. So if you can just address it with supplements, great. And then again, over time, fine. You can introduce other additional ways, but there's nothing wrong with just knocking it off with supplements and moving on with your life. Yeah.
Okay. So the next one of the basics is hydration. Look, in Australia, the math works out at you can go the American math. I'll do the Australian math. So the Australian math works out at 30 mils per kilogram per day is essentially what you want to be targeting. What's the American math?
Half your body weight in ounces, except for we measure body weight in pounds, right? And you guys don't use ounces. So that's where we were trying to convert it to Australian. I know it's pretty funny, but if you're un-American, half your body weight in pounds, in ounces, or global
30 mils per kilogram.
That's the one you really want.
If you've moved out of the 1960s with your numbers system.
Yeah, we should be using the metric system. I'm sorry.
That's all right. With that, that can be water. It can be
tea. Other liquids count technically.
Yeah, they all count.
Coffee even counts. Yeah.
Shouldn't all be coffee.
Juice would count, but it's a lot of sugar.
Coffee, but it shouldn't all be coffee. But that 30 mils per kilogram, which works out in that 2.5 liters a day for a lot of people. And
if you have pots,
how much and how many ounces is it? If you're
the hypothetical weights, like if you're 140 pounds, you should be getting 75 ounces. And I can't even convert that to liters because
70 ounces.
So it's like, how many liters is that? Yeah. And then go up, right? So with pots, again, 2.5 is going to be too little, more like 3. And when it's hot, right? Other stuff. Things like this, right? You can add little like electrolytes, different flavorings to your water too to make it more interesting. I'll make seltzer on purpose because the bubbles are a little bit different than just drinking water at times. And then from like an implementation perspective, it can be helpful sometimes to habit stack drinking water with other things that you always do, placing like water bottles around you or having it easy to do, because oftentimes it's just a distracted issue with drinking enough water. It's not that you don't know how to fill up a water bottle and drink it. So make it easier for yourself too, as far as getting the total amount you need to in.
Yeah. For those with POTS, the recommended target for the day is 10 grams of salt, which is essentially 2 teaspoons. And when if you're not tolerating that level of salt, or you're like, can't do it, or you're just sick of it, you can look at glycerol as well. So glycerol is something we use for hydrating with athletes. It will increase your blood volume. I can't remember the dose off the top of my head, but we'll chuck it on the website. And it gives you another alternative to salt as a means of increasing blood volume, which is a nice little trick from time to time.
Yeah, and hopefully, what you see out of this episode, the more things we've gone through, is if one thing doesn't work for you, there's another option, right? So if salt's hard, there's something else. If this type of protein, I don't tolerate it, there's a different type. It's not, I can't do it because, it's too hard. So yes, but there's often ways that you can work around some of those initial blocks.
Yeah. And if you can mix a lot of this stuff in to like one drink. So you could mix, you can easily mix in some protein, some fiber, some glycerol. I don't know if you want to chuck in salt, depending on what salt.
Depending on what else is in there. Yeah.
Anyway, you could probably chuck in the salt as well, but I'm not sure how that would taste. I don't think you want to mix in.
We'll do some tests.
Salt with your cola flavored protein.
Savory cola?
It's not going to cut it. I don't know. No. Anyway, so moving on. So next thing is then sleep. So
that's big.
So I think that you can have a target of 8 hours. I can't remember the last time I slept 8 hours. It's not bad.
Dance special.
No, it's not. Just naughty. Anyway, so let's say we put a target in and 8 hours sleep, and then
8 hours sleep, 9 hours in bed. That often means for people like me. So if you want 8 hours, it's not 8 hours in bed. First calculation. Yeah. But let's start there.
What are the basics? So I really like your basics. So let's go through the basics of sleep.
Okay. First step, anchoring, right? So go to bed at the same time, evening and morning. Typically it's easier to anchor one before both. So nail down going to bed at the same time every night. typically people have alarms, right? So it's definitely possible to try to tackle both at once, but you can try one and then bringing the other on board. And the more consistent you can get that, the better, because it really is what sets your circadian rhythm and starts to train and teach your body to more automatically get tired at the right time or automatically get used to cortisol rising and feeling more invigorated at the right time, instead of I am alert when I want to sleep and I'm really sleepy when I want to be alert. And again, it's an oversimplification, but routine is the antidote to stress. So the more all over the place you are, the more stressed your body is, and the more challenging it is to create capacity and not accrue, right, allostatic load and have like this much room in your stress bucket where then you easily overfill. So anchor things as best you can, as quickly as you can, to make the falling asleep be easier. Integrate a wind down routine. This is not difficult. It just takes some intention and, again, like discipline around it. And the wind down often starts before you get in bed, ideally. So there's more around all of this that we don't need to get into today, but just have a wind down routine, anchor your sleep wake cycle. And from a circadian rhythm perspective, I would say if you can get some natural sunlight, it's not what people think about when you think about sleep and recovery, but it's another way that you start to tell your brain what time it is because of the way that, you know, the light hits your eyes at a certain angle. So if you can hit dawn and dusk, now you've got two goalposts, just like with the sleep wake time, that is calibrating your rhythm and telling your brain, hey, I know what time it is. And then you get sleepier at the right time based upon that, instead of a bunch of overhead lights like at midnight telling your brain, hey, it's noon, or in that like nighttime at 8 p.m. and it feels like noon. So the more you can do to combat the reality of we have lights on later in modern society, the better, and the less friction and resistance you have to fight against, right, when you're trying to fall asleep in pain and in higher stress and when your mind is going more.
Nice. The other two things I think that are simple, which intuitive, but maybe we don't always use: dark room, cool room.
Yeah,
So,
surrounding environment pieces.
Yeah, those two things. So dark room, cool room, anchor, light in the morning.
And I kind of think of it like internal behaviors and then external environment that you can easily tweak.
I must admit, like I'd been trying to sort my sleep for years, and
you made some big
progress. I made some big progress. And I was mucking around, and one of the things I was mucking around with was cold showers. And I really found that cold shower before I go to bed, like it increases my deep sleep enormously. And so, and I've now been doing it for so long, like a couple of years now. My wife thinks I am absolutely nuts.
I think Katie
even when
right.
like midwinter,
the science is the opposite on this.
Midwinter in Melbourne. Yeah, but this is interesting.
But it's what works for you. Like I actually really like this example, and then I'll explain like why I suggest sometimes the not opposite because this is bad, but it's just.
We haven't ever had a conversation on podcasts about personal monitoring, but anyway, so from a monitoring perspective, like my deep sleep improves substantially. And so what is happening is, and you can see it with my heart rate, I'll have a cold shower. And then after the cold shower, what happens, you have an increase in your parasympathetic outflow. And so I get a drop in my heart rate. And it's that drop in the heart rate combined, that's all the parasympathetic stuff going on. And that's what's triggering off my deep sleep, I assume.
Yeah.
I don't know. Some sleep guys will probably be able to tell me better. But it's now come to the point that it's also a part of my wind down. It's now part of my...
It's triggers, you've taught your body, it's part of my thing.
This is like, okay, crazy cold shower, he's going to sleep now.
Yeah,
and
exactly.
if I don't do it, brain's like,
we're still doing our...
we haven't done this crazy shower shit yet, so I'm just going to stay up and think about other
more
stuff.
Work done. Yeah.
Like, so I'm like, okay, can we just like work together up there?
Can we compromise?
Can we compromise? Because like I really don't want to get in the shower today. It's really freezing as it is. No.
Yeah. But then I wonder, it's like, even in someone else's, context, would you go, I would take the increase in parasympathetic over, like if you did the opposite and you took a warm shower, the theory or thinking behind that is that warm water blood rushes to the periphery. Relative to that, your core temperature drops, right? It goes lower. And in order to fall asleep easier, you need a lower core temp. That's what touches on I'm too hot, I can't fall asleep. So what's the benefit of that? Personally, I like hot showers, but not before bed because it revs my leg up more. So it's not something that works for me, but it's something that works for other people. But then you could argue, would a cold shower maybe offer more upside from a parasympathetic nervous system regulating perspective than the core temperature drop? You have to just test and see.
Yeah, so I did that stuff first as well. So
although Dan's not normal, but he's not chronically complex.
No, but I did the hot stuff. I was doing the hot shower.
Did you try? Yeah. Because that's what everybody would suggest.
And as I was trying to work out my sleep, I was just reading, and I found a blog post by someone that said, "Oh my God, this just worked for me." Yeah, it was amazing. I went, try it. And interestingly, and they were using the same monitor I was using, so like an Oura Ring, which anyway, we can get into different monitoring techniques. Yeah,
we'll do. That'd be a good episode.
But they found it really worked. I went, okay, I'll give it a crack. And because I've got the monitoring stuff on, you do it and you see what works.
Right,
and
which is the nice thing about the monitoring.
I was like, oh my God, this thing worked. So now I freeze myself and then jump into bed, which annoys my wife.
It's like the application of the ice bath.
She's like, stay away, you're too cold. Anyway.
The ice cube entering the bed.
Yeah. Not happy. Okay, so
at least you're not snoring anymore. That's right. That's true. That's a trait.
Fix that as well. Okay,
that's right. But that's more advanced. But we
can talk about that as well. So anyway, so the next piece is then movement, exercise, right? And I think this is movement, and I think maybe movement is a better way because you use the exercise, the E word.
They're different. Fitness and movement are different.
And everyone
right?
gets
freaked out,
concerned, and so
different intentions behind them.
Yeah, really. As I mentioned before, I've had patients where I have not recognized how sedentary they are and how much that is playing a role in driving your pain because they're, metabolically, they're just not doing or they've not been able to do what we're actually built for, which is we are built to move.
Built to move. That's one of my mentor's books. That he released, Built to Move. That's exactly.
There you go. So how did you get somebody started? I've got a technique to get somebody started. You've got a bazillion. Go through some of yours and I'll give you my one technique. Yeah.
Well, I mean, it depends where somebody is at, right? So how much someone can walk is going to affect where you would start them from that perspective. There's a lot of folks who, when they can't take steps yet with, more severe complex regional pain syndrome, I too personally started on a bike. So before I could walk far, I could do cyclical activity with my weight, but more semi-supported with less of a response and blowback than I could initially to walking. Once I built out some tolerance and safety with that, then I could progress it with, getting further and further outside with my own steps. And so whether someone's able to do that or not, if they can't, then I'll begin with release techniques, kind of teach them how to work through pain or some more simpler forms of movement so that you develop some confidence and, ooh, that kind of hurt, didn't feel great, but, oh, actually now feels good. Now it's kind of soothing. And then that is a little bit of a mini, metaphor for what more challenging or more daunting forms of movement can be. And so there's a lot of fear, right, involved in moving, and fitness can be very overwhelming for folks. And so I find that if you can start them where they're at, build up some confidence with that, and then over time progress them, you have a lot more success than if something is just overwhelming to begin with. So for me, it took me years where I could then apply this to walking in and of itself, where I started going on small, it was 500 steps to begin with, and then I increased it 10% every week. So I added, 50-ish steps a week, for example, and then I was able to eventually go twice as far with the same amount of blowback, then further with less blowback. So it's not that you won't have any response to movement, but what you want is to be able to progress it in a way where the response doesn't grow the more you go. And if you have a flare or you overdo it, it's okay. Just regress it back 20% then, and then keep going. So find wherever you are, what you can tolerate, what modality of movement is easier for you. I also have folks who lifting weight in place is less stressful than doing anything cyclical or anything with their own body weight covering ground. So in that aspect, it can be more individualized, but it's also just really basic, like with the letterbox program or taking steps outside.
Yep. All right. So, and Jazz has alluded to my program, which or my description is a letterbox program. Is that what you call them in the US? Are they letterboxes at the front of mailbox? So you're in letterbox, mailbox program. So
yeah.
So what I get patients doing to start with is, walking every second day. Okay, so if you're doing very little, you want to go
break day in between.
You want to start day on, day off, which basically means that you're walking 3 days a week because you don't want to have consecutive days. And so that's the first point. Then the second point, we do the letterbox program. So the letterbox program is where you start and you walk to your own letterbox. And so day one, that's it. Work to your own letterbox. Day two, you go, or day three, so 1, 3, basically. So for the first 2 sessions, go to your own letterbox. That's it. Don't have to do any more. And then every 2 sessions, add a letterbox. And so
it's just like 10% or
yeah,
destination, if that's better, yes.
So it's a very small increment. So most house blocks in Australia are about 15 meters across. So you're basically adding around 30 steps every 2 sessions that you walk. And so you can then gradually just build it up. And if you find that you have a flare, that's okay. Just step it back to the number of letterboxes that you were at previously and then keep going again. And looking at that day on, day off is a great way to start.
Yes, that's a really, really good point because you have to have rest in there.
Yeah. And recover. Then as you progress and you're starting to be able to get into a longer walks and you're feeling comfortable, then you can add in the day between, but do half the distance. And so you go, okay, so Monday I'm going to do 20 minutes. And I'm going really, really well. So I'm doing 20 minutes 3 times a week. Now on Tuesday, I'm going to do 10 minutes. And you might maintain your 20-minute walk on Monday, Wednesday, Friday, and then you gradually build your Tuesday, Thursday walks up to that 20 minutes. So then we're hitting 20 minutes
every day,
5 days a week, and you're knocking it out of the park.
And you can either add volume, that's right, or decrease rest. In a sense, but yes, adding volume is what I want to do first.
That is a very, very simple way of just getting going. And so for those people that are, you're getting 100, 120 steps in a day, starting by walking out to the letterbox is where you need to start. That's a good increase in your number of steps, and give yourself a high five, and then in 2 days.
And it's what can you do, right? Building a baseline so that then the more individualized one-on-one, how are we building reflexive stability? What compensations do you need to improve? Where are you? But none of that matters if you're not even getting off the couch. Not that it doesn't matter, right? But you can't work on those until you also have some sort of movement in parallel. And so the other thing that is helpful to think about when you're sort of testing these things and changing ideally one variable at a time is often, right, it's the movement blew me up. Sometimes yes, but often it's the context around the movement. So did you have crappier recovery? Did you not eat enough, right? Are you super stressed? Did you have way too much that week? And then sometimes adding the increase in steps, the response to that isn't just because of the steps, it's because of the surrounding pieces. So that's important to be able to assess when you're testing and progressing yourself, when you don't have someone like me looking at those other context pieces. Yes. And then you can evaluate it better.
I think that the other thing to think about
and adjust it to the context that you have going on.
I think that one of the other things to think about that the exercise blew me up thing, so you flared, is one of the important things there is for people who are hypermobile. And so if you are hypermobile, what you are doing is you have ligament laxity that is being compensated for by muscle strength. Okay, there comes a point at which you have so much ligament laxity, you can't overcome that with muscle strength. And particularly if you've had, multiple episodes of wasting over time, you don't have decent muscle mass, blah, blah, blah. Add in on top of that, you're vegetarian or vegan, and
you're not getting enough
protein. And it's a little storm of its own.
It's a combination, perfect storm of this is flaring me.
Yeah.
Really bad.
So one of the important things to recognize there is that if you're doing strength activity and you flare after every time you do something,
it's a lack of stability.
My
underlying.
physio makes me worse,
Right.
then we need to think about ligament laxity. And how do you then address the ligament laxity?
Yes.
Because that's the reason why people flare, because you do your exercise, the
Right.
joint moves a little bit, and then afterwards, everything spasms afterwards. And because that's the response. So just don't get put off by that being the issue. Just recognize that, okay, that possibly means I've got a ton of ligament laxity. And if you can already touch your toes and, do the crazy things with your thumbs where you get them down, like you've got ligament laxity. So, yeah, like that.
That was a fun party trick, I thought, just in high school. It's like, can't everybody do that?
No, they can't.
No, I can't. Turns out. And 1.2 around the ligament laxity piece is this is an example where for a more typical patient, you can just do the walking before you work on stability or some of these underlying things. But if you're someone who is really struggling in that way, it can be helpful to work on in parallel, because if I just do nothing as far as my hip stability at times and I just go out on my walk, I'm off the bat kind of reinforcing my compensations and instead of giving myself the best chance to build new patterns in the range I do have. So that's a little bit of an outlier compared to a typical, more back, neck, and joint pain patient where you can just walk. So it's good nuance to, pull out if you're maybe a little more complex than you realize. Or you might just have hypermobility in a specific spot, right? It might not be symptomatic hypermobility all over. It might just be areas that then you can troubleshoot better, build up the strength, and not have that driver adding to, I don't like this.
Yeah, no, we need a whole episode on.
Yeah, it'll be so fun. We'll get into all sorts of reconditioning, movement. Yeah.
Particularly on hypermobility. It's
a problem.
It's an interesting bucket. Okay, all right, so let's wrap it up. So there are your 5 things. So the 5 basics are protein, 1.2 to 2 grams per kilogram per day.
Yes.
Fiber, 25 grams for females, 38 grams for males. Hydrate, 30 mils per kilogram per day, or
half your body
weight in pounds in ounces. Okay, great. 5, try and target some sleep, targeting 8 hours, and then exercise with a target of 30 minutes with a very gradual build up to 30 minutes. And then once you get past there, well, you can, go as hard as you like.
Then you can start adding strength and other things around it.
It's just the basics. Walk for 30 minutes. That's our basic.
Yep.
All right. So Juz, what else is coming in the next couple of weeks?
Coming down the pipeline, we will be releasing our nociceptive pain algorithm episode soon. And then that way, once all 3 algorithms are out, right, we have the neuropathic pain algorithm, we did our sensitization algorithm, and the nociceptive pain algorithm. That will allow us to get into any topic under central sensitization, a bunch of different subtopics and specific issues that relate to body part pain, neuropathic pain, right? We talked about hypermobility, SI joint dysfunction or instability is a great example too. So keep your eye out as well for our central sensitization assessment or questionnaire that we are also going to put on the website soon. If you haven't, after our last episode, gone back yet and checked out all the different pain assessments that we have on there thus far, please do so. Those are validated. They're not lesser assessments by any means. They're just the ones that are accepted currently. And then we'll add ours to it so that you can look at it through the lens that we've been discussing on the podcast. And
which
otherwise,
importantly isn't validated. It's just
which is not yet validated, but we think it's great. so that'll be a good complement to what's already out there, and is just a resource that then you can see your lay of the land better and do with that information as you wish. Yeah. And otherwise, as far as the Resilient Warrior coaching end of things, I'm going to be starting a weekly, speaking of movement class. That's going to be a basics sort of beginner neuro techniques group course for people with not just complex pain. A lot of us, unfortunately, have these underlying brain mapping issues, compensations, weakness, spasm sort of cycles that are unnecessary drivers of pain. And so that'll be a more accessible way that you can work on those things and not have to go just in one-on-one private sessions. And then, we'll have a group program coming up Q4 that will take you through the MARSMethod for chronic pain and how to actually start with movement and then progress it over time, layering in all the stuff that you'd want to once you get past the letterbox program. So these are all the basics that, are non-negotiables to be able to sustainably layer in movement, because you can't add more if you don't even have the building blocks in place, like protein, fiber, et cetera, to support and sustain what you're trying to layer in. So start with this stuff and then reach out to me if you need more help, and we will be, coming out with more down the pipeline. So go to our website in the meantime. Anything else, Dan?
No, very good. Thank you.
Great.
That was fun.
Thanks, guys. We'll see you next time on It's Not in Your Head.
See you, Joss. Bye. Thanks for listening. Clearly, this is a podcast. It's for informational purposes. It's not a consult, medical advice, or the practice of medicine, and it doesn't form a therapeutic relationship. If you feel the information might be useful for your situation, before applying it to yourself or others, you should speak with your doctor or your treating clinician. Do not delay in seeking a diagnosis or treatment, and applying the information is at the listener's own